Hi everyone. Today we are going to discuss about NUHM, that is National Urban Health Mission. I am Dr. Beulah Dallas, HOD of Community Health Nursing Department, M College of Nursing. The National Urban Health Mission is a key component of the National Health Mission launched by the Government of India. It focuses on improving the health status of the urban population, especially the urban poor living in slums and vulnerable areas. This NUHM aims to provide accessible, affordable, and quality primary health care services in the urban areas. Let us see the history of this program. This National Urban Health Mission was officially launched in 2013 as a sub-mission under the National Health Mission. Before NUHM, urban health services were fragmented and insufficient to meet the needs of rapidly growing urban populations. Recognizing the increasing urbanization and health disparities, the government of Tamil Nadu and India introduced NUHM to strengthen healthcare delivery systems in cities and towns. What's the rationale of organizing this program? Rapid urbanization in India has led to growth of slums and informal settlements, and urban poor face overcrowding, poor sanitation, unsafe water, and limited access to healthcare. High burden of communicable and non-communicable diseases among the urban vulnerable groups. Fragmented urban health services and lack of primary healthcare focus. NUHM was launched under National Health Mission to address these above-mentioned gaps. The aim of this program is to improve the health status of the urban population, particularly the urban poor and the vulnerable groups, to reduce morbidity and mortality by providing equitable healthcare services. Purpose of this scheme to address the healthcare needs of slum dwellers and marginalized urban populations, to strengthen public health infrastructure in urban areas, to ensure universal access to essential primary healthcare services. Objectives of this program is to provide equitable and quality primary healthcare services to the urban living people, strengthen urban health systems and infrastructure, reduce maternal and child mortality rates, improve sanitation and hygienic practices, promote community participation in healthcare, control communicable and non-communicable disease among the urban dwellers. Organogram. These National Urban Health Mission structure function as the multiple level. At the central level, we have the Ministry of Health and Family Welfare. State level, we have a State Health Mission. And the district level or city level, we have City Health Society or District Health Society. Under the facilities level, we have a Urban Primary Health Center and the Urban Community Health Center. Community level, we have ASHA, that is accredited social health activities. Those who are in urban, we call it as the USHA, Urban Accredited Social Health Activities. And the Mahila Arogya Samiti, shortly we can call them as MAS. Strategies: strengthening urban primary healthcare through urban primary healthcare centers, outreach services via urban health and the nutritional days, community participation through Mahila Arogya Samitis, engagement of urban USHAs for mobilization, convergence with schemes related to water sanitation and nutrition, public-private partnership for service delivery. Target populations: urban poor, especially slum dwellers, homeless population, migrant workers, street children, vulnerable groups like elderly, women, children, pregnant mothers. This program covers all the cities, towns with population more than 50,000, focus on cities with large slum population. It was launched in 2013 as a sub-mission of National Health Mission. This is an ongoing program, no fixed end of the date. The components of this programs, main thing is health infrastructure. So strengthen the health infrastructure in the urban area. So urban primary health centers, urban community health centers, they need to look after the staffing, infrastructure, the building and the equipments, medication, all those things. Human resources, doctors, ANM and OSHA and MAS, community processes or MAS and outreach activities, service delivery like maternity and child health, family planning, immunization, disease control programs, also referral systems for secondary or tertiary care. Services or NUHM provide a wide range of healthcare services. The main thing is MCH care. Under that, antenatal care, postnatal care, immunization programs, and the family planning services will be taken. Second thing is disease control, prevention and treatment of communicable diseases, mainly tuberculosis, malaria, dengue, and all kind of vector-borne diseases. Screening and management of non-communicable diseases, especially diabetes and hypertension, cardiovascular diseases, stroke. And the primary healthcare services are outpatient care, basic laboratory services, essential drug availability. Reproductive and adolescent health, here they are providing counseling services. Adolescent health program also will be conducted. Sanitation and public health, here health education on hygiene and sanitation, waste management awareness programs handled. Outreach services, conducting health camp and mobile medical units. Some of the schemes also under this program, that is Janani Surakshana Yojana for JSY, will promote institutional delivery. Janani Sishu Suraksha Karyakram JSSK, which will provide free maternal and child services. Rashtriya Bal Swasthya Karyakram RBSK, child health screening, family planning programs, and the National Urban Sanitation Initiatives also comes under this National Urban Health Mission. Let us see the role between Isha MAS and the community health nurse. So it's a comparison. So here the nature of thing for Usha, they are the individual frontline worker. This is MAS, they are the community-based women's group. CHN, she is a trained health professional. Level of work, the Usha, she is a household and the community level. Mahila Arogya Samiti, they are the community and group level. Community health nurse, she is facilities and the community level. She may be in the PHC or she may be in the community health center, like that. And the main role of Usha, link between community and the health system. Here the Mahila Arogya Samiti, their main role, community participation and empowerment. CHN, she will deliver the service as well as she will do the supervision. Regarding focus population, Usha focusing on urban poor family, MAS, women and family slums, and community health nurse, she will covering entire urban population, especially vulnerable groups. Key functions of Usha, mobilizing the people for health services. MAS, promote awareness and collective action. CHNs provide clinical and preventive care. Regarding MCH health, here the Usha track pregnant women, promote ANC and the immunization care, and MAS supports and motivate the mothers. CHN, she will provide antenatal care, postnatal care, immunization services at the slum area. Regarding health education, Usha gives basic health messages, MAS will conduct group awareness activities, CHN provide detailed health education and the counseling. Community mobilization, Usha door-to-door motivation, MAS organize community meetings, and the community health nurse supports and guides the community activities. Disease control, Usha identify and report to the cases, MAS spread the awareness on prevention, community health nurse implements national health programs. Referral services, Usha escorts patient to facilities, MAS helps in identifying cases needing referral, CHN provide referral and follow-up care. Regarding coordination, Usha works with ANM, CHN and the UPHC staff. MAS works with Usha and healthcare staffs. CHN coordinate with all level of healthcare workers. Supervision role, there is no supervisory role for Usha and the MAS, but CHN will supervise Usha and ANM. Financial role, Usha incentive based worker, and MAS will be maintain group fund and savings, and the CHN people will salaried staff. Record keeping, Usha 19 household data, MAS minimal records for like a group activity she will maintain, but CHN maintain official records and reports. Let us see the SWOT analysis of this program. Strength of this program: focus on urban poor health needs, community participations via Mahila Arogya Samitis, integration under National Health Mission. The weakness of this program: shortage of trained manpower, inadequate infrastructure in some cities, weak referral linkage. Opportunities: rapid urban health system strengthening, use of digital health and telemedicine, and the public-private participation expansion. Threat: increasing urban slum population, emerging diseases like dengue outbreaks and other vector-borne diseases, environmental pollutions, and lifestyle diseases. Let me summarize this topic. National Urban Health Mission is a vital initiative under the National Health Mission aimed at strengthening urban healthcare systems. It focuses on providing accessible, affordable, and quality healthcare services to the urban poor and vulnerable populations through community participation and improved infrastructure. Let me conclude the topic. The National Urban Health Mission plays a crucial role in addressing the healthcare challenges of rapidly growing urban populations. By improving service delivery, strengthening infrastructure, and involving community workers like ASHA and nurses, NUHM contributes significantly to achieving better health outcomes and overall urban development. Thanks for patience listening.